everyone. Welcome to another episode of Living with Hep B. I'm here for this episode, Thaddeus Pham from Hawaii.
I had an uncle who passed away from hepatitis B because he was diagnosed too late. And just witnessing the stigma that came with that among his family members. For me, there's a lot of personal stake in this, but also being a gay man in the community, I just see the parallels with HIV and just, people shouldn't die of shame or stigma and lack of access. The joke is, and I think people have heard it many times, is that they call me the queen of hepatitis in Hawaii, or your majesty. And I think, the queendom is quite broad. I mean, what we do in terms of hepatitis B is pretty much everything that touches on it, right? So from testing, from immunization, from linkage to care, we currently have a statewide elimination strategy that came out called Hep Free 2030, where we're going to try to eliminate Hep B and C and A in the next 10 years in Hawaii. Because we see stories as data, like as equally as important as those numbers that we collect and report. Carolyn, her father had Hep B, and they didn't, similar to my story with my uncle, they didn't know about it until it was too late, right? There's a lot of shame and stigma to it. So unfortunately, he passed because they addressed it and diagnosed it too late. And she became a nurse later, and she became an advocate. The second story is the story of Kenson. He's a Marshallese man who was diagnosed with liver cancer and Hep B. So it was almost too late for him. And, there was no real talk about this issue in his community. So once he got a liver transplant and he's kind of managing his Hep B, now he's a huge advocate and doing in-language work. Mm-hmm. And the third one is the importance and the intersection of, queerness and hepatitis B and how it's not really talked about in the community, even though it's recommended that all gay men get vaccinated, right? All these stories that all of them contribute to us and tell us kind of where we need to focus our efforts. Kenson, as I mentioned, Marshallese, and his wife is Chookies from the Federated States of Micronesia. They host a monthly talk story on Hep B in language and in English as well. And so to just raise awareness, right? It's very informal. And they invite me to this space, and now I come every month and I feel welcomed. And for me, I'm very proud of that, because we put in the time and we honor these communities. So to be accepted into a community that I'm not a part of really is very powerful. And I think it's really just maybe a testament to the work that our coalition does.
We here on the West Coast have the Project Echo, which is a program that allows physicians to come together, learn from a case study, and to work towards being hepatitis B specialists. And, that ties into the kind of work at being able to outreach to communities that might not have access to those healthcare services.
Our local providers in Hawaii attend your San Francisco Echo. So it has provided more resources in a way, or just the fact that we can have this talk and it's just so normal to have a Zoom chat is a kind of an opportunity as well. Because of that echo, our community health centers reached out to me, and they weren't doing as much Hep B as I was saying, but now they're way more interested in treatment, in engaging and getting more training. So sometimes I've noticed in communities where Asian Pacific Islanders are smaller, but more like cohesive in a way, that there's more of an impetus to kind of protect the community. But at the same time, when there's more Asian Pacific Islanders just overall, there's just more awareness about the issues for these communities. I think something that's challenging, for example, is our immigrant, refugee, and migrant communities who are Asian Pacific Islanders, because they have different healthcare access issues just by virtue of their citizenship status. Sometimes what people who outside the work forget is when we say Asian Pacific Islanders, and I'm also include Africans, is this is not a monolithic one culture, right? There's so many different cultures. How do we kind of work with these communities to kind of bring up awareness while still respecting the cultural mores that they have in place. We turn to our community leaders. So I mentioned Kenson and Rensley already as kind of the people um, who lead the conversation, right? So, in a sense, asking the people what they're interested in and then integrating Hep B is what has been working.
I think that's one of the key things that allows for both of our organizations to be successful.
We actually modeled our coalition after your coalition, actually, when we
Yeah.
started in 2011. So
Yeah.
we're like junior, basically.
And 10 years, it's a long time. And
The work actually started 10 years ago from our first meeting as a coalition, just building all these relationships over 10 years. And so the process required engaging with our communities. And so they identified the 5 priorities for us. The 5 priorities are awareness, and education, access to services, advocacy, equity, which I had mentioned before, and data. And if you think about it, access is the health one, right? That's access to testing, linkage to care, care coordination, vaccination, and it's only 1 out of the 5. So even though we might eliminate hepatitis, we're still going to be addressing awareness about it to maintain prevention. We're still going to be addressing equity issues that come with hepatitis B, like healthcare access for immigrants and refugees. We're still going to be dealing with data collection to kind of monitor the situation. And we're always going to be doing advocacy for and with our communities to ensure that, protections are in place, right? So the work will continue, I think, after we eliminate hepatitis and have a big party with you all. The work continues. Yeah.
Thaddeus Pham, everybody.
Take care, everyone. Bye.
Bye.